How many people did you have with COVID here in your hospital in June?
We had 14 in June.
Now?
We're over 220. We're seeing more patients now than we've seen ever before, Vaughn, that are sick with COVID and very ill. We're having mostly younger patients in their 40s and 50s.
Are you seeing 20-year-olds, 30-year-olds?
We are. I've even admitted a patient as young as 3 weeks old to the hospital with COVID.
Yeah, a Jacksonville ER doc who says the patients are now younger and healthier than ever before. And we know Florida's hospitals are swamped. That state is heading toward its worst coronavirus outbreak yet. Hospitalizations tonight are up to 10,389. The AP reports at the University of Florida Health North Hospital emergency room in Jacksonville, COVID-19 patients once again were being put in beds in hallways due to a surge in visits. And in South Florida, there's an alarming rise in younger COVID patients. The Miami Herald reports many need intensive care and nearly all are unvaccinated. For more, we welcome to the broadcast Dr. Bernard Ashby. He's a Miami-based cardiologist and the Florida state lead for the Committee to Protect Healthcare. Thank you so much for being with us, Dr. Ashby. Florida, now the epicenter of this virus. You told my colleague, Jeff Bennett, earlier today, this is Groundhog Day all over again. Tell us about the flood of patients you're seeing now and how quickly this situation has worsened.
Well, pleasure for having me here. And it's great to have a platform speak on behalf of Floridians and healthcare professionals down here. I mean, this is, we're having PTSD. I mean, the initial surge that we went through was very disturbing, very stressful. And we thought this was behind us. I mean, we had the vaccination campaign. We thought that the light was at the end of the tunnel, but yet here we are again. But the difference is our leaders, particularly our governor, has really done nothing in terms of slowing this, freight train down. I mean, really, he's opposed to any mitigation measures. He's come out staunchly against really any mandate against enforcing masks. And we know that that's a tool that definitely slows down the transmission of the coronavirus. And the fact that he's making it a political issue as opposed to a public health issue is definitely impacting our morale in the hospital.
Well, for example, Broward County Public Schools said they were going to have a mask mandate. And then when Governor DeSantis said what he said, they backtracked on that. How worried are you as kids are heading to school? And how frustrating is this for you and your colleagues? Because you know what works.
I mean, I've been saying the same thing over and over and over again. Let the professionals do their job. Let us do our job and just consult with us. Let's come up with a strategy that addresses his concerns, the leader's concerns, as well as the public health concerns. The two are not mutually exclusive. But rather than do that, we have no mitigation measures. We've been shut out of the conversation. And in fact, Governor DeSantis actually attacked myself and my colleagues when we decided to speak up about this, saying that, mitigation measures basically won't affect us, basically says that we don't know what we're talking about. And this kind of flippant attitude is something that is really at the height of disrespect, but I consider reckless. And I think he's taking the page out of Trump's book because people forget that during the winter surge, when we were at our peak, Donald Trump did absolutely nothing after losing the election. And by all accounts, it looks like it didn't hurt him at all. And I think he's making a political calculation over the health of the population. And from our standpoint, this is not the time to play politics. I believe that a lot more people in Florida would be, more willing to accept him if he actually did his job. And the fact that he's being derelict in his duties is very revealing. And so, when there's a point when your leaders are actually choosing politics over lives, that is something very disturbing. And so, I don't know what to do at this point. I'm just going to continue to speak up. I've gotten a ton of messages from healthcare professionals who thank me for speaking up because I'm saying and echoing things that they feel. And right now we are at a breaking point, and it's only going to get worse. And once school starts, things will continue to get worse. And We really don't know what to do at this point. We just hope that he has a change of mind.
I can't even imagine what it's like to have the governor of your state attacking your credibility, attacking your professionalism.
Yeah.
But as you said, you're not alone in that. And all of you folks, all of you have been on the front lines for this entire pandemic. I mean, are you going to have enough staff to handle this severe a surge? And what are the conversations like among you folks at the hospital? How exhausted physically, mentally are you?
I mean, people are stressed, especially the nurses. I mean, the nurses don't get enough credit for what they do. They're the ones that are with these patients day in and day out. They're in the rooms, being exposed to the virus. They're actually sacrificing their own health, knowing that there's a possibility that they can get infected, even though they've been vaccinated, because the Delta variant is so much different. The equation has changed. The viral load is much higher, and the chances of breakthrough infection are much higher. And as a result of that, they're actually putting their lives and their health at risk. And, the fact that we don't have the backing of our leadership is something that is demoralizing,